Welcome to Live United. Today I'm joined by Kathy Baird. Kathy is the director of RSVP, a program of Monadnock Family Services. Welcome, Kathy.
Thank you, Kelly.
Kathy is joining us here on Live United, where we share stories and opportunities for people to hear about the great work that's going on in the Monadnock region that makes a difference in people's lives. So tell me a little bit about RSVP, and let's start with, I use the term RSVP, but I'll let you describe what that means.
Okay. Our legal name is Monadnock RSVP Volunteer Center, and probably people in the audience might have known RSVP formerly as the Retired Senior Volunteer Program. It's a federally funded program by the Corporation for National and Community Service, and the purpose is to engage adults over the age of 55 in meaningful service opportunities in the community. But we also work with volunteers of all ages, so we also have the Volunteer Center. And we work with about 45 nonprofit and public organizations, as well as have signature programs ourselves. And we have about 612 adult volunteers who were active in 2012.
Wow, that's a lot of volunteers.
It is a lot of service hours.
It's a lot. Do you know how many service hours you provide?
Last year it was 32,800 hours, I believe.
So let's talk a little bit about some of those hours, where those hours go to. I know you have the Neighbors Indeed and the America Reads program. So let's start with America Reads.
America Reads is probably our most beloved program that we have. It's a national literacy program to get children up to their grade level of proficiency in reading by the end of third grade. We used to start at kindergarten with that program, and we would match volunteers one-on-one or in small groups to read once a week for an hour. And what we have learned is that it's important to start earlier and to have those earlier interventions. And so in the next 3 years, we'll be expanding to the Head Start programs to serve economically disadvantaged children, because often in their homes they don't have that one-on-one time reading. They may not have access to books, or perhaps their families use smaller vocabularies and engage in less conversation. So we have that program in 10 schools right now. 3 of them are districts in need of improvement, and 3 of them have not made adequate yearly progress in reading.
So as you do the America Reads program, I know Keene State College students are also engaging in that. Are they volunteering through you or connecting with you?
They are not. Their program is very different than ours. Theirs is a work study program. I think perhaps one of the largest differences, besides a different population, most of our volunteers are older adults who are retired, and they bring a very high level of maturity to their assignments. It's really important to the literacy piece of that program, but even stronger than that is the mentor type relationships that they're developing with these students. Also the relationships that they're having with the schools and the teachers, because most of our volunteers return year after year after year. We have a very high retention rate with that program, which the schools love that, because at the beginning of the year they can just get the volunteers going because they've already worked in the schools, they have the training, and they have those relationships there.
Now, you mentioned that it's primarily senior volunteers. When you say senior volunteers, are you talking 55 up? Are you talking 65 up? A lot of people have different definitions of what a senior is.
We really are trying to use the word older adults versus seniors. That's part of why the corporation stopped calling it the Retired Senior Volunteer Program, because many older adults who are 55 don't identify themselves as seniors, and many of them are not retired. I know my husband, he's 57. He certainly doesn't identify himself as a senior by any means.
Uh-oh, letting out family secrets.
He's going to love this on Christmas Day.
You also mentioned that you do a Neighbors Indeed program. What is that about?
Neighbors Indeed is our independent living program. We started that program in 1994 with a grant under the Robert Wood Johnson Foundation. They're the largest foundation devoted to health and health care. And we started that program because we were seeing that there were gaps out in the community for seniors who had either chronic illnesses, they were isolated in rural areas, they weren't able to drive, they were low income. And it was based on the concept of neighbors helping their neighbors, real simple concept. And so we started that program very small, and it has now grown to about 55 volunteers. And what we do, it's almost like Match.com. We match volunteers one-on-one with, now these really are seniors for the most part, seniors who could use some companionship and assistance. And it really is the combination of companionship and assistance because people develop friendships. So they may just visit somebody who might be homebound and can't get out, or maybe they don't have any family members or friends. We're seeing a much older population of seniors, well into their 80s now. But oftentimes they help with taking them out to the grocery store and providing that supported assistance, taking them to medical appointments, maybe doing a social activity. And for the most part, that's once a week for a couple hours. Once matched, volunteers can do more than that. And it's really, the magic of the program is that people become friends, and it doesn't feel like a service. So for some seniors who may be reluctant to accept help, because it's really hard to ask for help, and then even once it's offered to sometimes accept it, it doesn't feel like a service, and it really is the whole magic of the program. The families love it, especially those, they're coming home right now for the holidays. They're seeing their moms, their dads, and they're like, oh my goodness, they said everything was just great. And what kind of service is out there? So this time of year, we're getting a lot of calls from families who are saying, my mom and dad, they're not going to be able to get out so much this winter. What kind of services do you provide? The nice thing is there's no limits on hours, so there's a lot of flexibility if they want to do something in the afternoon or on the weekend, during the week, and people really decide their schedules together, so it offers that great flexibility for both the recipients and the volunteers. There is a episodic component of that program where we do light handyman repairs for people that couldn't do it themselves anymore, or perhaps they couldn't afford to hire someone. Sometimes it seems silly to hire a handyman to come in and put a light bulb over a stairwell, but you couldn't do it yourself because you have some mobility issues. But things that the volunteers do could be installing grab bars, small plumbing repairs that don't require licensing, fixing a broken step, locks that worn out. We do seasonal things like, installing the storm doors and screens, that kind of thing. For the National Day of Service on September 11th, we actually did a little bigger project. We did a ramp build in Hinsdale for a veteran. So we do have the capability of doing that as well.
I was actually just going to ask you about that because I know you participated in National Day of Service, and we coordinated some of that together, and that you do work with veterans. What are some of the other services that are available to veterans?
Well, last year we received an augmentation grant from the Corporation for National and Community Service to expand our focus specifically to veterans and military family members. So there are two parts to that grant. One piece was expanding our Neighbors Indeed to match veterans specifically to other veterans or military family members who need help, companionship, and that assistance. And the idea was that they have that common bond that is really critical to the relationship. And we held a focus group with military veterans to have an understanding of how to match people, and it was interesting that they thought combat veterans may be better suited with somebody who could relate to that. So that was one piece of the project, was expanding the Neighbors Indeed program to that population. The other piece was recruiting veteran volunteers to drive for the Red Cross for local and long-distance appointments, particularly the long-distance ones, so that they could expand their capacity to meet the growing needs in the community. So that would include rides to White River, Boston, which is a little tough, and Manchester. And we have found that interestingly enough, the veterans really like the driving piece. That's been particularly attractive to them. Also, the light handyman repairs, because it's something that they can immediately see the difference it makes in the people that they're helping.
So it sounds like you have them both volunteering to serve other vets, as well as receiving services. You're serving the elderly population, and you're certainly serving our youth with the America Reads program. Are there other things you want the public to be aware of?
Well, I think it's really important to speak that we're helping the organizations in the community, the 45 that we work with. Many of them are doing so much more with so fewer resources, whether it's funding, staffing, more needs, and just being able to keep up. So we are the only single individualized volunteer management service that screens volunteers and matches them to opportunities in the community. Oftentimes, smaller organizations particularly don't have a volunteer coordinator, and it's really hard for a director to manage a volunteer program as well as the entire organization. So that's one piece of it that we do, is recruit for them and send the right volunteer to that organization, which requires us to really know the organizations that we're working with, to understand their mission, to understand the work they do, their culture. It's a lot like a job. You want to match everything so that it's a good match and it's successful on both the organization and the volunteers' part. The other piece with organizations is that we work with them to teach them best practices of volunteer management. Volunteer retention is really, really critical, and we get that question a lot from organizations. How do you retain volunteers? Well, one is the matching piece. That's really, really important. But the other piece is to recognize the volunteers, say thank you, make them feel part of your organization, and also to give them meaningful work, because without meaningful work, people won't stick around. So we work with them so that they can have strong volunteer programs.
Wow, I didn't realize that was a service you provided. That's fabulous. Tell me a little bit more about the impact that you have on people's lives. You mentioned that you do some kind of odd jobs to assist people. That ramp building for a vet was probably a critical need that someone had. What are some of the other things that you're doing?
Well, if we speak to independent living, most elderly people want to stay in their homes as long as possible. It's really hard to pick up and leave and go to a smaller apartment or go to assisted living or even a nursing home. And research shows that the seniors who stay in their homes have better health outcomes and live longer. So that's actually one of the things that we do see, that most of our volunteers who are matched, they stay with their care recipients for the duration, and usually it's when they become very old that there's an immediate significant change and then something happens. But we've had some matches in that program that have existed 15 years, and it's amazing to see how the situation evolves. And one of the really neat things is that volunteers in a case such as that, they start at one place and they can see how things change, and they have that relationship and they can make suggestions or contact us and say, this has changed. They can advocate on behalf of that senior to get them other services so that they can stay in their homes and be safe and happy, and really importantly, have a quality of life.
You know, we had Erica on a previous show talking about the Western Hillsborough Family Services, and she mentioned both your program, but she also talked about that having one or two adults in your life for a young person in particular, can make a real difference in terms of the successes, your goals, your dreams, and how you attain those. And it sounds like some of what you're doing is really building those generational relationships. 15 years, that's like being a grandparent almost to someone.
Absolutely. And speaking about outcomes with the America Reads, I mentioned a little earlier that they developed the mentor relationships. But with the literacy needs, it's really critical that they get to their grade level of reading by the end of 3rd grade, because it shows that after 4th grade, many of those students, if they're not at the grade level, they're going to drop out. And it's so critical for those students in their success academically and their work and their life that they are at that level, so that they graduate high school. They're likely to go on to post-secondary education or get some certification, which is going to be critical with the types of jobs that are in our future. Also, they have better health outcomes, they make healthier choices, and this really ties into substance abuse, alcohol use, teen pregnancy, and even child abuse in the future. So starting at that early age is such a critical bridge and preventative measure that really is going to carry throughout their whole life.
Well, we know from the well-being report that was done with through United Way and Charitable Foundation that educational attainment's a real need, livable wage, that we have seniors that are in need, we have young people in need, and you're bridging that gap between those two populations and bringing them together for that educational opportunity in particular through the America Reads program. Sounds like you're also providing an opportunity for that social isolation that either of those groups might experience to be addressed. So having real impact there. Are there any types of things, because you're a federally funded program, are there any types of outcomes our national level is looking at?
Well, all these things I've already mentioned. There are national performance measures under the Serve America Act. They have standardized performance measures for all the national service programs, which include the senior core programs, including RSVP, foster grandparents, senior companions, AmeriCorps, and the Social Innovation Fund. So we all have the same performance measures so that they could wrap up the data and make a statement to Congress. So with any of our big focus areas or work plans that we're working on, we have those determined for us and what types of measurement tools we'll use. For instance, with America Reads, we're using assessments and standardized tests, and the teachers do a survey without saying who the student is, but they fill out a survey based on those test scores, but that's a standardized measure.
Now, would that scare people off at all to think that they might have to do these measures or surveys? Or has your experience been that for your volunteers, it's just kind of part of how it goes and it's just built into the flow?
Well, it is really new for us. We're very much in a reinvent stage because this is the first stage of actually having to adhere to these new performance measures. In the past, we used to be able to determine our own measures and how we would measure them, but those days are over, and it's not a choice. It may be uncomfortable, it may be even a little bit of a challenge, but we have great working relationships with our agencies that we work with, and they know the value of our program, and they understand the importance of these measures and how important it is to educate funders about the value of service so that programs such as RSVP continue to be funded. It is a bit of a mind shift. I think some people it's scary, but we've been doing performance measures for at least 15 years. It's just a slight shift on how we are going to do it.
And I want to remind our audience that that's your job to do the performance measures. It's not about it's about the successes you're having with the people that you serve, and that's really what they need to worry about and be concerned for. But again, that when we all work together, it does make a difference in people's lives. You mentioned that some of your measures are used for things like advocacy at a federal level. Is there anything at a state or local level that goes on in terms of advocacy?
Mm-hmm. Well, I like to use the word educate. It's really important for us to educate. There are regulations surrounding advocacy, but it's important to tell our political leaders the value of service, the numbers, these performance measures. But a really important piece is to put a face on those measures that, they look at numbers and reports all the time, but it's important to tell the story of the difference it makes. For instance, this year in America Reads, Marlboro School was in touch with us and they said, we have 3 boys that are really, really struggling right now, and they saw it very early on. And all 3 of these students had some really sad stories, and they knew if these children don't get the extra help, they're really going to have problems for the year. And they were like, do you have any male volunteers that are available to come in and read with these boys during the week? And so we found a America Reads volunteer who has gone in. And at first the boys were little tentative. They're like, I don't know about this. And it took a few weeks for them to warm up to this gentleman. And then afterwards, they were looking forward to it. And the teacher said it was almost immediate. You could start seeing the difference that these students were starting to have better behaviors in school. They were paying attention better. They were having better relationships with their peers and with their families. And so that's just a little intermediate impact. And obviously, it's to help them get up to their reading level, but we're so excited that there was such a wonderful response right in the beginning, and we can't wait to see the end of the year, and hopefully be able to hear the stories of even further down the line that these 3 boys that really could have fallen through the gaps, how successful they can be in their lives.
It's always nice to see a skeptic turn the other way, and through mentoring especially when you have that intergenerational piece. I love when you see an older person being able to really be such an important role model in a young person's life. Are you working at all with our legislators here in New Hampshire?
That is one of my goals this year is to learn more about the process. We did receive a proclamation from the governor last year for one of the National Days of Service, so that was exciting. It's definitely something that I need to learn more about, and it's part of my role as the director. It's important because funding is so hard to get that they need to be aware of the value of service in our communities, and that it really is a very cost-effective way to solve these big, huge problems. And it's going to be a collective effort. We're just part of the whole system.
So let's talk a little bit about what is happening at a federal level with some of the funding cuts. Will that impact programs like yours at all?
We don't anticipate it at this point. We have reapplied for a competition grant. It's a new competitive grant process for the RSVP programs. Our program was in the 2nd phase. Our grant was submitted in August, and we will find out in February. But I felt that it was a very strong application. Many of the activities that we will be doing are some of the things we're already doing, like America Reads and Neighbors Indeed, and growing those programs even more. But a couple new things we'll be doing is more in disaster services. One of the things we learned from our volunteers on our annual survey is that they really like continuing to learn. And we said, we really need to weave this into the activities that we're doing. We also learned when the hurricane came this fall, we were prepared ahead of time, notified by the corporation to be ready to respond if there is a disaster. And we got on the phone because we knew we may not have power or access to our database to get in contact with the volunteers, get a way to contact them, cell phone numbers, what would they be willing to do. And it was amazing. We had over 30 volunteers respond that they were willing to help with a disaster. And we said that should be something that we should be doing, because in this region right now, if we were to have a long-term disaster that lasted 7 days where a shelter had to be manned 24/7, we don't have the number of volunteers that is needed, which means that Red Cross or another organization would have to draw the volunteers from another area, which could have a critical impact on the health and safety of the residents here in the region.
So let's talk a little bit about some of your collaborations and who you work with, because there's the Public Health Network and Emergency Preparedness. I would imagine you connect with them on a project like you're talking about where there may be a disaster and volunteers are needed, and I know they have teams that they mobilize. There's certainly the American Red Cross that comes in situations like that. Who are some of the other partners that you might team up with for the different programs you're doing?
Well, the Red Cross is one of our big ones because we're doing the transportation. We also supply volunteers to about 18 different blood drives in a year and supply all the volunteers, and they can call us up almost at the last minute and know that we have people that really love doing it. It's really a fun social kind of activity. And then, of course, the disaster piece will be a new component with the Red Cross. For our Neighbors in Need program, we have about 15 different agencies who refer to us, clients that they work with who need extra support in their lives. We work with the VA up in White River, the one here in Keene, the medical center and the counseling center. Home health care gives us lots and lots of referrals because they are providing the Meals on Wheels, they're sending in the aides to do homemaking, and they see the people that need that extra socialization. Lutheran Social Services refers to us. We have so many different ones, and sometimes we get a new one right out of the blue because they're looking on the internet and they're like, wow, I didn't know there was this program in the region that did this individualized one-on-one service, and it's also the only service that does that for no charge to the recipients.
So I want to make sure we get in here a couple of times how to contact you. So if people wanted to volunteer or they were in need of your service, how would they contact you?
We have 2 offices in the Monadnock region. Our main office is here in Keene at 64 Main Street on the 2nd floor. We're housed with Monadnock Family Services. That phone number is 357-6893. Our other office is in Peterborough at 9 Vos Farm Road with Monadnock Family Services, Suite 120, and that's 924-7350. And we also have a website, www.monadnockvolunteercenter.org.
Okay, I will ask you to repeat that at the end for anybody that missed it. Wanted to also talk about some of the other future directions. Where do you think things will head for you?
I think one of the big things is that we're really going towards the big needs, the big, huge ones that are under the Serve America Act: education, economic opportunity, veterans and military family members, healthy futures, environmental stewardship, and also doing capacity building for organizations. So that requires different levels of skills. We'll be doing more targeted recruitment specific to the activities that we will be doing.
So you mentioned targeted recruitment. What will be some of your needs as you move forward?
Well, for instance, with disaster services, perhaps it's a certain type of group we would target. One of the pieces of data that the corporation has extracted from their research already is that disaster services is attractive to veterans and military members who have maybe special certifications. It's also attractive because they learn new things. They also can travel all over the world once they're trained for free, so that's kind of a nice perk for somebody. But that's just one example. With America Reads, we may be targeting the AAUW group. not necessarily teachers want to do it. You don't have to have special skills to be America Reads. But those are the types of things. Instead of just going out and doing a presentation, we'll really be focusing on our activities and targeting groups that would love to collaborate with us.
Do you have needs that go beyond volunteering for the programs and the services you're providing?
Absolutely. With our Neighbors in Deed program, often one of the things we get is caregivers. Whether they're living with the person, living in the same town, we get calls from across the country, and often when we start the conversation about what their needs are, what the situation is with their loved one, we start hearing things that perhaps they waited a little bit too long for independent living services, and that there's this feeling of frustration and angst on their part. And it's really trying to discern if our program can help them. Sometimes we do home visits and we find out it really is beyond the scope of what a volunteer can do, because they're not nurses, they're not social workers, they're just kind, genuine people who want to help. So we are very knowledgeable about the resources in the region, having worked with 45 to 60 agencies over the many years. And we have compiled a resource book that, it changes over the years. Some organizations are no longer in business and there's new ones. But we refer them to other resources if it is beyond the scope of what we can do for them. And that's a nice benefit because a lot of times people don't know where to start, and we're the first phone call, and they go, "Oh, thank you so much. I just had no idea where to go."
So you can refer people to other services. Want to remind the audience that you can always call 211. That is funded by the United Ways, actually across the nation, but it is a great way to reach out if you can't remember the phone number or the website for your organization. You mentioned that you recruit volunteers, and those volunteers can come in and they can do one day of service or they could do multi-day. Is that correct?
That is correct. There are no requirements for RSVP volunteers in terms of how many hours you have to serve or how many days a week you have to serve. Unlike the foster grandparents and senior companions, there is an income eligibility and they're required to do 20 hours a week. RSVP volunteers can choose how much and where they want to volunteer their time and their skills.
And what kind of training do you provide?
Well, with the agencies that we work with and provide volunteers, they are responsible for providing job-specific training to their own programs and orientation to their staff and organization. For our own programs, we do trainings. There's a 4-hour training for America Reads with an RSVP staff person, a reading specialist, and a retired teacher. And it covers the school culture, the environment, techniques and strategies to work with children with reading, code of conduct, administrative duties, and safety precautions in the schools. We also have 2 in-services throughout the year on different topics that might be attracted to volunteers who are in that program. When there was Newtown, we had the superintendent come in and he did a workshop on the new protocols for safety in the schools in the region, and we had a great attendance for that. The volunteers were just amazed at how much things had changed. We also do criminal background checks on all the volunteers as well as references for that program. Our Neighbors in Deed program, we do a 4-hour training as well, and that's more of a hands-on type of training. We do decision-making scenarios, we talk about resources, we do some communication exercises on particularly boundaries. Sometimes it's hard for people to say no, and some of these people need so much help. They can easily ask for more, and some people have a hard time being able to set those boundaries. Also, a lot about the resources so that as they know that their person and things change, they can make nice suggestions to them of other things that they can do. We do, for that one, criminal background, driver's checks, reference checks, BEAS, Bureau of Elderly and Adult Services registry checks. So all the volunteers in our programs are very well vetted. They can feel confident that we've met with them, we know who they are, and that we're sending a great volunteer into the schools and into people's homes.
Now, you mentioned that they can provide transportation. Is that for very specific transportation needs, or is that part of a companionship piece to help somebody go shopping, for example?
Yep, that's part of that companionship. And the differentiation between, say, our program, the Neighbors in Need program, and the American Red Cross Transportation Program, or CVTC, is that ours is that one-on-one relationship, whereas they may get a different driver every single time they have a ride request. Ours is really on a relationship level, that people have that same volunteer all the time to develop a relationship and provide that supported assistance that goes beyond just walking up to the door, but actually inside and helping them with those kinds of things. So shopping, errands, it could be a social activity, that kind of thing.
We've talked a lot about seniors, but you do have a volunteer piece that is for people that may not have reached those older years yet. Can you talk a little bit more about that?
I would say one of the pieces that over the years we've seen a huge increase is community service, because the courts are offering that as an alternative to, for the most part, I would say, young adults. So we get probably 100 calls anyways a year from young adults who are looking for small amounts of service in the community, and so depending on what they have done, because there are many places that depending on what they have been charged with they can't go because of a vulnerable population, how many hours and when they need it to have it done by. We have to be kind of creative and think about what they can do at an organization and make appropriate suggestions so that we're still responsible to our organizations that we're working with, that we're not sending somebody that's not appropriate. That's been a really big trend for us. And sometimes it's challenging. Sometimes people, they're not going to make it on their deadline. And if they call up this week and they need it 50 hours by next week, they're not going to make it.
Well, one of the things the United Way sees, I know, is that we get phone calls, and we may have a corporate group that says, we have 60 volunteers to send out on Saturday. And lots of times it's in response to national crisis. Sometimes it's in response to local things. What are some of the local needs that you see that you may need more volunteers for?
Well, large groups, and I remember a request from the United Way for a large group of 60, and working with our partner agencies during the week, that is really challenging depending on what time of year it is. Winter would be really tough. It's also important to understand what their goals are out of their volunteer work. What are they hoping to accomplish, and matching it to the right opportunity. 60 would be really tough for many of the organizations during normal business hours. Sometimes we ask, can the group be split apart? And really, when those kinds of things come up, we talk to the organization or group, what they're hoping to get out of it. And then we specifically look at our agencies and make phone calls to find out what might work. And I remember this particular situation that one of the organizations said, well, 60? Wow, that's a lot. Good luck with that.
No, it's very true. And, sometimes the need is there. Sometimes the need is always there for volunteers, certainly. And sometimes it's greater than others, depending on what's going on in the world. Are there areas of the region where you really could use more volunteers?
Absolutely. I would say that any of the rural areas, the further outside of Keene that you get, or the further outside of the hub of Peterborough, they become very, very difficult. It's also areas that have fewer services available to them. Some of the towns don't have a grocery store, which requires people to travel to them. Hinsdale's extremely hard, and it's also one of the areas that is the most neediest in the community. We're hoping to be able to work with the Head Start in Ashwila, and that some people will really be interested in working with the children out there. But it is a tough area, and we recognize that and want to be able to serve them. Greenville's another very, very difficult town out there. I would say also Marlow. So those far corners, and people are very generous there. They're just very small towns.
So sometimes the capacity is just an issue. So certainly people that can volunteer and have the ability to maybe travel within the Monadnock region and reach out to communities they may not necessarily live in is important. It sounds like too that because of some of your focus with the America Reads program, folks from the Winchester, Hinsdale area would be important in the future.
Oh, absolutely. And we do have a really great America Reads program in the Winchester Elementary School. And we are definitely looking for more volunteers so that we can continue growing that.
I know the after-school programs are really moving in the direction of how they prepare young people for being ready by, they call it ready by 21, but leading successful lives. Are you engaged at all in connecting to the after-school with the America Reads program?
Well, we have done in the past Skip over in Peterborough, and it's a little bit different focus when it's an after-school program versus working directly with a teacher who is perhaps choosing some material. So it is a little bit of a different twist. With the America Reads program, we always have to remember we have to measure according to these new measures. So it might be a little bit trickier now with the after-school programs because of the requirement with surveys based on the standardized test. Maybe they might not have the same access to those results. So it is a little bit trickier.
So it sounds like you're getting more and more focused, and that people who are really interested in mentoring young people around reading, providing services to vets, connecting with people of their own age, and just providing companionship are all important things. Again, how can people reach out to you?
Well, again, our Keene office is 357-6893. Our Peterborough office is 924-7350. And our website is www.monadnockvolunteercenter.org.
Okay, and I'm going to have you repeat that one last time very slowly.
Keene office is 357-6893. Our Peterborough office is 924-7350, and our website is www.monadnockvolunteercenter.org.
Great. Thank you so much, Kathy, for joining us. I want to remind our audience that you have an opportunity to share how you're living united, and you can do that by contacting us at liveunited@muw.org. to share your story about how you're making a difference out in the Monadnock region. As you've heard Kathy say, she's doing a lot of great work, and through the programs that they provide, they are serving populations of all ages. So please reach out. Remember, volunteer, give, advocate, live united.